If you are a man over the age of 60 and you have noticed changes in your erections over recent months or years, I need you to understand something that could genuinely change and potentially save the rest of your life. What is happening in the bedroom may have very little to do with the bedroom. It may have everything to do with your blood vessels. And I completely understand that this is not the conversation most men are eager to have. But I am asking you to stay with me through this entire video, because what I am about to share with you is not just about your sexual health. It is about your heart, your brain, your kidneys, your life. I am Dr. Julia Rhodes, a men's sex therapist with over a decade of experience working with different couples and helping men regain their sexual health and strength back. A significant part of my clinical work involves sitting with men over 60 who come to me feeling embarrassed, confused, and quietly resigned about changes in their erectile function. Men who have either ignored the problem entirely or walked into a pharmacy, picked up a medication, and moved on without ever asking the question that truly matters. Why is this happening in the first place? Today, I want to answer that question properly, and I want to do it in a way that is direct, honest, and grounded in the clinical reality of what I see in my work with men in this age group every single week. Before we get into it, please subscribe to this channel right now if you have not already done so, and turn on your notifications. Every week, I publish content specifically designed to help men at every stage of life understand and protect their sexual health, hormonal health, and cardiovascular well-being. This is the kind of information that your doctor may not have the appointment time to explain in sufficient depth, and it matters enormously. If today's video speaks to you, please share it with a man in your life who needs to hear it. The more men who understand what I am about to share, the more heart attacks that never happen. Now let us get into it. Let us start with something that might surprise you. Erectile dysfunction affects approximately 50% of men over the age of 50, and that figure increases substantially as men move into their 60s, 70s, and beyond. Among men over 60 specifically, the prevalence is estimated to be between 50 and 70%, depending on how severity is measured. That is an enormous number, and the vast majority of those men either accept it as an inevitable feature of aging, feel too embarrassed to discuss it with a healthcare provider, or address it purely symptomatically with medication without ever investigating what is driving it. Here is what most of those men do not know, and what I want you to understand clearly before we go any further. In men over 60, erectile dysfunction is, in the majority of cases, a vascular problem, not primarily a hormonal problem, not primarily a psychological problem, a problem with blood flow, a problem with the health of your arteries, and more specifically, erectile dysfunction in this age group is one of the earliest and most clinically reliable indicators of systemic cardiovascular disease, often appearing years before the heart or brain show any symptoms of their own. What that means in plain language is this. The changes you are noticing in your erections may be the first signal your body is sending you that your cardiovascular system needs attention. And if that signal goes unrecognized or is simply managed with a pill without any investigation into the underlying cause, the disease process that created that signal does not stop. It continues. It progresses. Silently. Until the blood vessels it has been quietly damaging are no longer the small penile arteries, but the coronary arteries supplying your heart, or the carotid arteries supplying your brain. And by that point, you are no longer in early warning territory. You are in crisis territory. I am sharing this not to frighten you. I am sharing it because you deserve to have this information clearly and completely. Because the men who act on this kind of early signal are the men who prevent the heart attacks and strokes that otherwise would have been their story. Let me take you through the physiology, because once you understand exactly what is happening biologically, everything else I am going to share with you will make complete and immediate sense. An erection is fundamentally a vascular event. It is a plumbing process. It has very little to do with what is happening in your mind or in your relationship, at least from a physiological standpoint, and everything to do with the health and function of your blood vessels. Here is how it works. When you become sexually aroused, your nervous system triggers the release of a molecule called nitric oxide. Nitric oxide is one of the most important signaling molecules in the human body. Its primary function in the vascular system is to instruct blood vessel walls to relax and dilate, to widen and open up, allowing increased blood flow to pass through. When nitric oxide is released in response to arousal, the blood vessels in and around the penis dilate. Blood rushes in through the penile arteries and fills the spongy erectile tissue, the corpus cavernosum, causing it to expand and become firm. Simultaneously, the veins that would normally carry blood away from the penis compress and close, trapping the blood inside and maintaining the erection. This entire sequence is completely dependent on healthy, functional, responsive blood vessels. It requires a healthy endothelium, which is the single-cell thick lining of your arteries that produces nitric oxide and regulates vascular tone. It requires arteries that are flexible and capable of dilating appropriately. It requires adequate nitric oxide production. And it requires vessels that are free from the kind of structural damage or narrowing that would impede blood flow. Now consider what happens when any of these requirements begins to be compromised. What if your arteries have been gradually stiffening over years of high blood pressure? What if the endothelium has been damaged by chronically elevated blood sugar, by decades of smoking, by persistently high LDL cholesterol, or by the low-grade systemic inflammation that accompanies visceral obesity? What if your nitric oxide production has declined because the endothelial cells that produce it are no longer functioning as efficiently as they once did? What if early atherosclerosis, the gradual buildup of fatty plaques within the artery walls, has already begun to narrow your penile arteries? The answer to all of those questions is the same. You will struggle to achieve or maintain an erection of the quality you once had. The vascular machinery that makes erections possible will be impaired, and the result will be erectile changes that feel like they are about aging because they correlate with aging, but are actually about the progressive deterioration of cardiovascular health that is far too common in men in their 60s and beyond. And here is something worth sitting with for a moment. For most men over 60, this process did not begin recently. Atherosclerosis and endothelial dysfunction develop slowly over decades. The dietary patterns, the years of slightly elevated blood pressure that was never addressed, the exercise habits, the stress that accumulated without adequate management, all of these factors have been quietly influencing the health of the vascular system for a very long time. What is new is not the underlying disease. What is new is the threshold being crossed. The penile arteries are small enough to show symptomatic changes before the larger, more life-critical vessels do the same. And that is precisely what makes this moment so significant and so important to act on. Now, here is the crucial piece of information that connects all of this to something much larger and much more serious than the bedroom. The penile arteries are small. approximately 1 to 2 millimeters in diameter. The coronary arteries that supply your heart are significantly larger, approximately 3 to 4 millimeters in diameter. The carotid arteries that supply your brain are larger still. When atherosclerosis or endothelial dysfunction begins to develop in the vascular system, it affects the smallest vessels first, because a given degree of narrowing or damage causes a proportionally much greater reduction in blood flow in a small vessel than in a large one. Think about it mathematically. A plaque that is 0.5 millimeter thick, sitting inside a 1 millimeter penile artery, is already causing a 50% constriction of that vessel. Blood flow through that artery is severely compromised. The man will notice symptoms, namely changes in his erections, quite early in the disease process. That exact same 0.5 millimeter plaque sitting inside a 4 millimeter coronary artery represents only a 12.5% narrowing. There are no symptoms at that stage. No chest pain, no breathlessness, no warning of any kind. But the plaque is there, and it is not static. It will keep growing. It will keep narrowing those larger vessels. Year after year, silently, until it reaches the threshold at which symptoms begin, or until it ruptures, causing an acute blockage, and the result is a heart attack or a stroke. This is why erectile dysfunction in men over 60 appears, on average, 3 to 5 years before the first symptoms of coronary artery disease. This is why multiple large-scale studies have found that men with erectile dysfunction have a significantly elevated risk of major cardiovascular events, including heart attacks and strokes, compared to men without it, even after controlling for all other known cardiovascular risk factors. And this is why I describe erectile dysfunction in this age group in clinical terms as a cardiovascular stress test that your body is performing on itself and presenting you with the results. Let me be direct about something that I feel strongly about from a clinical and ethical standpoint. The ability to purchase erectile dysfunction medications over the counter without a doctor's consultation has made accessing symptomatic treatment faster and less embarrassing. And I understand the appeal of that. But for men over 60 who are noticing new or worsening erectile changes, walking into a pharmacy and picking up a medication without speaking to a doctor first is, in my clinical view, a genuinely concerning approach. Not because those medications are inherently unsafe when used appropriately, but because of what that approach means you are almost certainly missing. Medications like sildenafil work by amplifying the effects of nitric oxide in the penile blood vessels, effectively helping the vascular machinery function better despite its impairment. They address one consequence of the underlying vascular disease. They do not touch the disease itself. They do not reverse the atherosclerosis. They do not repair the damaged endothelium. They do not lower your blood pressure or reduce your LDL or improve your insulin sensitivity. They simply make one symptom of systemic cardiovascular disease temporarily more manageable, while the underlying process continues progressing, unexamined and unaddressed. For a man in his 60s, the stakes of that trade-off are high, because for every year that the underlying cardiovascular disease goes unidentified and unaddressed, the silent damage to the vessels supplying your heart and brain accumulates further. The men who go straight to symptomatic management without investigation are the men who sometimes find themselves 5 or 10 years later in a cardiology ward or a neurological rehabilitation unit, looking back and wondering whether the signals were there earlier. They almost always were. So what should you actually do if you are a man over 60 and you are noticing erectile changes? Let me walk you through this clearly and practically. First, and most importantly, speak to your doctor. Not after you have tried the pharmacy option, before. Frame it this way in your own mind. This is a cardiovascular screening appointment, not just a conversation about your sex life. Because that is clinically exactly what it is. Your doctor needs to know that you are experiencing erectile changes, because that information is medically significant. It changes the level of cardiovascular investigation that is appropriate. The specific tests and assessments you want to ask about are the following. Your blood pressure. Hypertension is one of the leading causes of endothelial damage and one of the most common drivers of erectile dysfunction in men over 60. It is also almost entirely symptom-free until it causes organ damage. Many men have significantly elevated blood pressure for years without knowing it. Get it checked and get it into the healthy range. Your HbA1c level. This is a blood test that measures your average blood sugar over the preceding 3 months and is the standard screening tool for both prediabetes and type 2 diabetes. Insulin resistance and elevated blood sugar are profoundly damaging to the vascular endothelium, and the prevalence of undiagnosed prediabetes and type 2 diabetes in men over 60 is substantially higher than most people realize. It is not an exaggeration to say that a significant proportion of men watching this video may be in one of these categories without knowing it. Your lipid profile. This measures your LDL cholesterol, your HDL cholesterol, and your triglycerides. High LDL is the primary driver of atherosclerotic plaque formation in artery walls. Understanding where your lipid levels are is essential to understanding your cardiovascular risk picture, and it is information that should directly inform both your medical management and your dietary choices. Your waist circumference. This is a simple but genuinely informative measurement. Take a flexible tape measure and measure your waist at the level of your navel. Waist circumference is a reliable proxy for visceral fat, which is the metabolically active fat stored around the internal organs. Visceral fat is a major independent driver of insulin resistance, systemic inflammation, and cardiovascular risk. A waist circumference above 35 inches in men is considered a significant risk indicator. And then the broader lifestyle picture. Your smoking history and current status, your physical activity levels, your diet, your sleep quality and duration, and your chronic stress levels. All of these are vascular risk factors. All of them contribute to endothelial dysfunction and the progression of atherosclerosis, and all of them are modifiable. The degree to which lifestyle changes can slow, halt, or even partially reverse cardiovascular disease is genuinely remarkable. And this brings me to what I consider the most important and most hopeful part of today's conversation. The things that improve erectile function in men over 60 are not a different list from the things that improve cardiovascular health. They are the same list. Completely and precisely the same list. Regular aerobic exercise is the most potent lifestyle intervention available for improving endothelial function and nitric oxide production. When you exercise aerobically and consistently, the increased blood flow through your arteries creates a mechanical shear stress stimulus that the endothelial cells respond to by producing more nitric oxide. More nitric oxide means better vascular tone, better blood flow regulation, lower resting blood pressure, and measurably better erectile function. The cardiovascular benefits are equally compelling. Multiple large meta-analyses have found that regular aerobic exercise reduces cardiovascular mortality by 30 to 35% in men with existing cardiovascular risk factors. For men over 60 who may feel that it is too late to start, the evidence is clear. It is not. The vascular system retains meaningful capacity to respond to exercise-induced improvements, even in the 7th and 8th decades of life. Even 30 minutes of brisk walking 5 days per week produces demonstrable improvements in endothelial function within weeks of starting. Resistance training, combined with aerobic exercise, improves insulin sensitivity, increases lean muscle mass, reduces visceral fat, and supports healthy testosterone levels, all of which contribute to both cardiovascular health and erectile function. For men over 60 who may not have exercised regularly in years, starting with gentle, progressive resistance work, even 2 to 3 times per week, produces measurable benefits within weeks. A Mediterranean-style dietary pattern, meaning an emphasis on vegetables, legumes, whole grains, olive oil, nuts and seeds, oily fish, and moderate fruit intake, with a reduction in processed foods, refined carbohydrates, and red meat, has among the strongest evidence bases of any dietary approach for both cardiovascular risk reduction and independent improvement in erectile function. The landmark Predimed trial demonstrated a significant reduction in major cardiovascular events in people following this dietary pattern, and separate research has found meaningful improvements in erectile function scores associated with Mediterranean dietary adherence. Weight loss, particularly reduction of visceral fat, dramatically improves insulin sensitivity and vascular health. For men over 60 who are carrying excess abdominal weight, even a modest reduction of 10 to 15% of body weight has been shown to produce clinically significant improvements in blood pressure, lipid profiles, blood sugar regulation, and erectile function. Managing blood pressure, blood sugar, and cholesterol, whether through lifestyle change, medical management, or both, directly reduces the rate of further endothelial damage and atherosclerotic progression. When these risk factors are well controlled, the vascular system recovers function that was being suppressed by their presence. Sleep deserves specific mention here because it is one of the most underappreciated factors in vascular and hormonal health in men over 60. During deep sleep, your body performs critical vascular repair processes and releases the majority of its daily testosterone. Men who are sleeping fewer than 6 hours per night, or who are sleeping poorly due to undiagnosed obstructive sleep apnea, are subjecting their vascular system to repeated cycles of oxygen deprivation and stress hormone exposure that directly accelerates endothelial damage and atherosclerotic progression. Obstructive sleep apnea, which is extremely common in men over 60 and is heavily associated with both erectile dysfunction and cardiovascular disease, is also one of the most undertreated conditions in this age group. If your partner has ever mentioned that you snore heavily or appear to stop breathing during sleep, please raise this with your doctor as a matter of some urgency. Treating sleep apnea can produce dramatic improvements in energy, erectile function, blood pressure, and overall cardiovascular risk profile. Chronic psychological stress is equally important. Sustained stress elevates cortisol levels, which suppresses testosterone, impairs endothelial function, promotes visceral fat accumulation, and raises blood pressure. For men over 60 who are carrying chronic work stress, relational stress, or unprocessed grief and loss, addressing the stress load is not a soft or secondary health consideration. It is a cardiovascular intervention in its own right. Your erections, in other words, are a living, real-time barometer of your vascular health. When they improve in response to lifestyle changes, it means your arteries are genuinely functioning better. When they decline, it means your arteries need your attention. They are the most intimate and personal cardiovascular monitoring system you have available, and they are giving you continuous, reliable information about the health of the vascular network that is keeping you alive. Do not dismiss that information. Do not suppress it or sidestep it. Use it. I want to close with something that I believe with complete conviction, based on everything I have seen in over a decade of working with men's sexual and cardiovascular health. The men who take erectile changes seriously at 60, who use them as the clinical signal they genuinely are, rather than a private embarrassment to be managed symptomatically, are the men who prevent the heart attacks and strokes that might otherwise define the next chapter of their lives. They are the men who are still healthy and active at 75, who are still vital and engaged in their relationships, who are still experiencing genuine physical and emotional intimacy with their partners, because they paid attention to a small signal at the right moment and acted on it with intelligence and courage. I also want to say something directly to the men in this age group who may be carrying shame or embarrassment about these changes. You should not be. Erectile changes in men over 60 are extraordinarily common. They are physiologically explicable, and most importantly, they are meaningful in a way that extends far beyond the bedroom. There is nothing shameful about a body that is giving you information. The only regrettable response is to ignore that information or suppress it without investigation. The men who walk into their doctor's office and say directly, "I have noticed changes in my erections, and I want to understand what is driving that," are making one of the most intelligent and proactive decisions available to them. They are treating their body as the sophisticated, information-rich system it actually is. The biology is genuinely hopeful. We are not talking here primarily about damage that cannot be reversed. We are talking about a system that, when treated with the right interventions at the right time, has a meaningful capacity to recover and improve. That is the position you want to be in. And recognizing erectile changes for what they truly are is the first step to getting there. I am Dr. Julia Rhodes, a men's sex therapist with over a decade of experience working with different couples and helping men regain their sexual health and strength back. If today's video gave you something that genuinely changes how you think about your body and your health, I need you to do 3 things right now. Hit the like button because it helps more men over 60 find this content at exactly the moment they need it. Leave a comment below and tell me whether this changes how you are thinking about erectile changes you may have noticed, because I read every comment and your responses matter deeply to what I create for this community. And please subscribe and turn on your notifications if you have not already, because every single week I am here with the honest, evidence-based, clinically grounded guidance on men's health that you deserve. The smallest signal is sometimes the most important one. Please do not ignore it. I will see you in the next video.